Now you're doing telehome care today,
Yes.
and what kinds of patients are you monitoring, or is OTN monitoring?
Telehome care is a very exciting area for us. What we've been doing is really working with the LHINs, which are the regional healthcare authorities here in Ontario, to enroll patients with congestive heart failure and chronic obstructive pulmonary disease. What we're doing is a couple things. One is providing them with remote monitoring tools in their home. That includes things like a blood pressure cuff, a pulse oximeter. We also ask them questions. So based on clinical guidelines that have been developed by experts, they answer questions like, are you short of breath today? Did you cough? Whatever it is, so that we can track their progress on a daily basis. Their nurses then monitor that data. That's part of the program. The really exciting part of the program is that these nurses are trained to be health coaches, right? So they work with these patients to really help them understand their disease and to set goals that these patients can follow to improve their health status. That's a little different for these nurses. A lot of nurses are pretty used to telling people what to do. That's their job. This is different because they're really empowering patients to set their own goals. So they'll typically call a patient and they'll say, you know, what is it you care about? What do you want to do? And the patient will say, well, you know, I want to spend more time with my grandkids. The nurse will say, fantastic. Let's see what we have to do to give you more energy so you can spend more time with your kids. A very, very different approach for us. So there's a lot of ways to use you know, remote monitoring technology, video in the home technology. Some of them are not that valuable. I mean, the technology is just the technology. It's how you use it that's important. And so the model that we're using is very specific. It's combining the technology with a nurse coaching model. The idea is to empower these patients to really change their behavior and stay out of the hospital and stay healthier. And that seems to work. To me, that's the best model I've seen. So in our pilot program, which we enrolled about 813 patients, we had about 800 patients with congestive heart failure and chronic obstructive pulmonary disease. And remarkably, the program evaluation showed that there was about a 2/3 reduction in their hospitalization rate, 70% reduction in their emergency department visits. Now that's self-reported data, so you have to take it with a bit of a grain of salt, but even at half that level, you know, those are very dramatic results, particularly compared to, you know, the cost of the intervention. So based on that data, we're rolling out a similar program. What we're trying to do right now is to really put something in place that's more scalable. So we've been developing a sort of a scalable technology solution, and we've been trying to integrate it into the everyday practice across the LHINs to see if we can get similar results at a broader scale.